Reverend Deneen Robinson, the Policy Director at the Afiya Center, and I will be your moderator today. I would like to welcome all of you, those who are joining us as panelists, as well as those who are watching us live via Facebook, to a reproductive justice polling in the South, What Black Women Think in Texas. This is a conversation that centers the voices and perspectives of Black women and their right to reproductive justice and reproductive autonomy. We will address reproductive justice issues that affect the overall health and wellness of Black women while providing polling data, critical reflections, and offering guidance to community and policy stakeholders in Texas and beyond. Again, I would like to thank you all for joining us. As the policy director for the Afiya Center, I want to let you know that we are bringing you this discussion in partnership with In Our Own Voice, the National Black Women's Reproductive Justice Agenda. The Afiya Center, we are based here in Dallas, Texas, and our mission is to serve Black women and girls by transforming their relationship with their sexual and reproductive health through addressing the consequences of reproductive oppression. In Our Own Voice, our national partner, is a national organization that provides us with partnership and does policy initiative that is designed to amplify and lift up the voices of Black women at the national and regional levels in our ongoing fight to secure reproductive justice for all women and girls. This webinar is one of several Deep South polling briefings in our partnership this year as the Black women's reproductive justice movement expands its base of engagement, support, and influence across the Deep South, and paints a picture of what Black women really think about political issues that are impacting our bodies, families, communities, and lives. Today's webinar intends to amplify the political views of Black women on reproductive justice issues in the state of Texas. As we continue to move through the stark impact of the COVID-19 pandemic, in a year where we have also seen attacks on basic reproductive health care and an assault on Black women and brown people by state-sanctioned violence, we recognize that there is not nearly enough research and polling data on Black women's political views. It is our goal to provide tangible data for communities and policymakers alike that uplift Black women's political perspectives. Today, we are joined by Marcela Howell, the founder and president of In Our Own Voice, National Black Women's Reproductive Justice Agenda. She will present the polling data for Texas. After Marcela's presentation, we will continue the discussion with leading folk, including Marsha Jones, co-founder and executive director of the Afiya Center, followed by a panel discussion that will include Marsha, as well as Representative Toni Rose of the Texas House of Representatives, District 110, and Dominique Walker, a Texas-based organizer, and I am so excited that she is a new employee with the Afiya Center, and she is a staunch social justice advocate. We have reserved a 10-minute time slot for questions at the end of the webinar, recognizing that this is not enough time and that as an organization, we are committed to continuing this conversation via the Afiya Center. During the presentation, the chat box will be disabled on Zoom. However, the Q&A box will appear during the Q&A portion. If you are viewing on Facebook, you may also pose questions during that time through the Facebook comment section. Please follow us at Black Women's RJ and at the Afiya Center to view and share the Facebook live stream. Now let's get into the data, which will be presented by our first speaker, Marcela Howell, founder and president of In Our Own Voice, National Black Women's Reproductive Agenda, who will present the Texas polling results. And Marcela, an advocate and policy strategist, she is recognized for her expertise in strategic communications, leadership development, and policy forecasting. With over 40 years of experience advocating for women's rights, reproductive justice, and women's empowerment, she is devoted to enhancing the role of Black women in national policy debates on issues that impact their lives. It is my pleasure to introduce Marcela Howell.
Thank you very much, Deneen. I really appreciate all that you said about me. It's like, oh, okay, but thank you very much. As Deneen said, I'm going to talk a little bit about the polling that we did in Texas, but I want to say that we did polling in 7 southern states as part of our Deep South collaboration. We did polling in Alabama, Arkansas, Kentucky, Louisiana, Mississippi, Tennessee, and Texas. And so I'm going to present those findings. The polls were primarily about abortion rights and access, but we also added in questions about financial security, about issues dealing with the impact of racism and over-policing in communities, because we wanted to really get a sense of how Black women approach different issues, but also how they made decisions about whether or not to start or expand a family. Our polling was done by a firm called Perry Undum, and it was done both from phoning and also online surveys. And we've compiled all of that data. Next slide, please. We did 500 Black women in each state between the ages of 18 and up. In Texas, 84% of those we polled identified themselves as being voters in their state. And that's really important because we wanted to be sure that we were talking to voters and that they were expressing how they felt about the policies that existed. Next. In Texas, only 13% of Texans self-identified as being Black. In that Black population, 51% were Black women and girls. Next. So the first question we asked was about Roe v. Wade. As you know, we now have a very conservative Supreme Court, and so there are concerns about whether or not that court will overturn the Supreme Court decision, Roe v. Wade, that established a woman's constitutional right to have an abortion. And so we asked people if they would like to see the Supreme Court overturn Roe v. Wade or not. 67% of the Black women that we polled said they wanted to uphold Roe v. Wade and make sure that abortion remained safe and legal. 32% said they were interested in overturning Roe. Next. We also asked a question about financial security, and nearly all of the women, even those who said that they might want to overturn Roe, said that control over childbearing is important for the financial security of Black women and their families, literally 96%. So we wanted to look at the financial security in Texas, in each of the states. 19% of Black families live in poverty in Texas. Of those, 72% of the Black families in poverty are headed by a single woman. But we also looked at questions about their education. 89% of Black women in Texas have a high school diploma or more education. So living in poverty had very little to do with their education level. Next. But we did find out that it had a lot to do with the wage gap. Black women in Texas get paid 58 cents for every dollar a white man makes doing the same job. What that means is over a lifetime, Black women in Texas lose $1,014,800 because of this wage gap. And to translate that into easier terms, what it would mean is that a Black woman would have to work until she was 89 years old to make the same amount of money that a white man makes when he retires at the age of 65. Think about that. 89 years old, she would have to work until she was 89 to earn the exact same amount that a white man in Texas would make when he retires at the age of 65. We also wanted to find out how Black women fared in terms of those who had children already. 69% of the respondents said that they had children of different ages. Next. And so we asked them what should be part of basic health care. 91% said that basic health care needed to care for pregnant women, which means prenatal and postnatal care. And as we know, with the increases in deaths of Black women during pregnancy or after pregnancy, that is really important that care of pregnant women be part of just basic health care. They also said contraception or family planning. 89% said that that should be part of basic health care. And then 52%, a majority, said that they thought that abortion care should also be part of basic health care. So we asked people what factored into their decisions about having a child or expanding their family. And it was really quite fascinating in terms of the answers. 67% of the Black women said that racism factored into whether or not they would have children or expand their families. 62% said access to a living wage job. And as you recall, when we looked at how much Black women in Texas made in relationship to every dollar that a white man made, this having a living wage job was really important. 54% said having affordable health care. 54% also said having child care accessible. And 52% said food security. And if you think about where we are right now with COVID and the unemployment rates that have happened, especially among Black and brown families, that this idea of food security is really important. 52% said having access to good quality food was really important in their decision-making about whether or not to parent. 50% said affordable housing was important, and 43% said over-policing in their communities factored into whether or not they would have children or expand their families. Racism also impacts health in Texas. 56% of the respondents said that racism has a negative impact on their mental or emotional health. 39% said that racism had a negative impact on their physical health. And for younger Black women between the ages of 18 and 34, 67% said that racism had an impact on their mental and emotional health. So 56% of women of the entire age range of what we polled, but 67% of younger women said that racism had an impact. That's a high percentage when you think about it. Next. We also looked at over-policing again. 43%, as I said before, said that over-policing factored into decisions about whether or not to have a child. But for younger women, ages 18 to 34, 55% said that over-policing factored into their decision-making about whether or not to have a child or to expand their family. That's 12% higher that younger women felt that racism impacted their lives and their decision-making. Next. Next slide, please. Okay. We asked a question about how people felt the experience of having an abortion should be in their community. 79% said that experience should be simple. 77% said it should be affordable, so that they wouldn't have to borrow from families or sell things in order to get abortion. 76% said that decision should be respectful. And we know that a lot of Black women have said that when they go into clinics or they go to a doctor's office with their minds already made up about whether or not they are going to terminate a pregnancy, that they sometimes feel that their decision is not respected by people that they go to meet with. 75% felt that abortion care should be available in their own community. And 65% said they should be able to access abortion as soon as possible. And what we know in Texas and in other states is that there are a number of barriers to that accessing abortion rights as soon as possible. Many times there are laws that say they have to meet with the physician first, and then there is a waiting period anywhere between 24 and 72 hours that they have to wait before they actually have the procedure. So it was very clear that 65%, an overwhelming majority, felt that those decisions that they make should be available to them as soon as possible. Next. However, many are unsure about the legal status of abortion in their state. Only 54%, a majority, yes, but only 54% thought that abortion was still legal in Texas. 9% felt that it was illegal, and 37% said that they weren't sure about whether or not it was legal. And if you think about some of the laws that have been passed in Texas that deal with abortion rights and accessing it, it is not unusual that a third of the people that we interviewed felt that abortion, they just didn't know whether it was still legal or not. Next. In fact, 64% of the people who we talked to said that they felt that abortion was at risk in the country. 34% said it was fairly secure. In Texas, however, 63 think that the right to abortion is at risk in Texas, and only 36% felt that it was fairly secure. 45% of the respondents felt that it was harder to have to get an abortion in Texas, while 37% felt that access had not changed, and 16% said that it was becoming easier to access abortion. Next. We asked a question about whether or not who people felt should make decisions about abortion care, and whether or not people should be able to get access to abortion. 63% said that the woman or the person involved should make decisions about how and when to access abortion, and that lawmakers should not be involved. 60% said they were more likely to support candidates who also supported abortion rights. Next. Many women reject the idea of abortion stigma, and more Black women have been starting to talk and shout out about their experiences in getting abortions. 57% of Texas Black women said that abortion is not a religious issue for them. 78% said that abortion can be a responsible choice for an individual, and 81% rejected any kind of shame or abortion stigma related to getting an abortion. So it was very clear to us that people felt that they had a right to abortion. They were concerned about whether or not abortion would be deemed illegal at the Supreme Court level, and that they felt that it was harder to get access to an abortion in Texas specifically, and that they rejected any shame that was connected to it. And even those who were very religious still rejected the idea that abortion rights was a religious issue, and that instead it was a responsible decision for Black women to make. So now I'm going to go to the next one. I'm going to turn this back over to Deneen to introduce the panel and have them respond to not just the data, but overall to what's happening in Texas.
So I want to thank you, Marcela, for highlighting these findings. They are definitely important to the work that each of us do across the state of Texas in the various ways that we engage. And I want to also say thank you for your time, because I understand that you will be leaving us shortly. We will now move into discussion, beginning with Marsha Jones, co-founder and executive director of the Afiya Center. Marsha is a Texas native, and as I said, she is the co-founder and executive director of the Afiya Center. She holds a bachelor's degree in psychology and is a graduate of the Black AIDS Institute's African American HIV University Science and Community Mobilizing Fellowship, and she's also a graduate of the Tyndale Theology School. Marsha has served on various boards and capacities as an active service to and honor of Black women, a national grassroots organizer, community mobilizer, professional speaker, and health educator with a commitment to transforming the lives of women and girls. She has pledged to participate in the development of leadership and engagement of activism among women by challenging harmful systemic and political constructs to advance the economic, health, and safety of Black women and girls. We will welcome Marsha. Marsha, can you share with us how this polling data plays a role in your work as an executive director of a Black women's reproductive justice organization in the Deep South, and specifically in the state of Texas?
Sure. And so first, I just want to say thank you for this opportunity for the Afiya Center. This is always great opportunity for us, an opportunity for us to get this information out to communities that that we are not always talking to, and then also it give us the data that we need to support what we know, and so this is always so very important. So thank you, Marcela. And not just for this one opportunity, but for the opportunity that being a part of In Our Own Voice have made, and the difference that they have made for the work that we do at the Afiya Center and how we show up in communities.
Yes.
So this is really the way this information helps us at the Afiya Center, and why this information is so important to us at the Afiya Center is that being in Texas, being a Black women-centered organization, after really diving into headfirst reproductive justice work or abortion work or whatever, one of the things I quickly realized is that the conversations that was having in the state of Texas around reproductive rights and health was led by white women-led organizations. It was very steeped in just abortion or just choice, but it was kind of there was this kind of misnomer that perhaps it was reproductive justice. And so it really wasn't reproductive justice, it was reproductive choice. It could have been reproductive justice, well, but it wasn't. And so there was people talking about what was happening with black women, but nobody had did the work. There has been no research. There was just an assumption. Nobody was talking to Black women. All these people were talking for Black women, but not talking to Black women, which meant that Black people were not necessarily taking on this information, agreeing with this information, or buying into this information. And so it just seemed like for Black folk, people were talking about us and not telling the right story. And so so when we came in to do this work, they trusted the Afiya Center, but they wasn't really sure about this information that we was giving. You know, there was this thing because Black women have been so our reproductive choices have always been politicized. Our reproductive choices have always been judged harshly. Our reproductive choices have always been shamed, and our bodies have always been shamed. And so up against that kind of a backdrop, Yes, people knew that they had the right to get an abortion. Yes, people knew, but how do I say this publicly? Who's going to support this? And then the Black church, the faith-based community, did a really bang-up job with shaming folks' reproductive choices. And so we knew women in the church. We were those women. We are those women. We knew that we wanted to make sure that our daughters had access to abortion. We knew these things had to happen, but we didn't necessarily have as strong of a voice as we thought we had in church. So this information, so I'm going back to the first polling data as well as the data that we have now. And that first polling data was a mind blower for me. When I saw that information and it said over 70% of folk inside of the church were in agreement with folk having, well, basically agreeing with bodily autonomy and saying that folk, and they agree with folk having access to abortions. They agreed that folk should have, that we should be doing comprehensive sex education. So that gave us a really strong tool to work with, because we had to be able to work with those who had the most power in the communities that we were serving. And for the better part, that was the Black church, because there's so much power there. And so we were able to deconstruct some of those ideologies that were not so. They were not based in fact. They were just based in how a person thought. And so that was very important. And then we were able to really support Black women in their choices, whether that be to parent or to not parent. And then it provided us with the data to support the reasons that for so many times that Black women choose whether or not they're going to or not have children. It was not, it was more than just a matter of birth control or some of the other things, but it had a lot to do with economic injustices. It had a lot to do with environmental justice. It had a lot to do with political disenfranchisement. It was so much more. And so our work have always been centered from an intersectional framework, but for the first time, being a very small organization, not having the resources to get this data that we know we needed, having that in our hands and allowing that to lead our conversations, it changed how we showed up in the work. It changed how we were able to talk to communities. Now, I know a lot of, I struggle with some of this stuff sometimes, because what I do know is that there is a whole group of women who are 100%. This data is so reflective of who they are. But many of the women that we serve at the Afiya Center, they're not women who are already registered to vote. They are not voting. They are people who are maybe just getting out of prison or who are still connected with the prison industrial complex. They are these women who don't have privilege to this kind of information. They are women who are not as educated as other women. They are women who are still subjected to this this patriarchal way of thinking and not having no real control of their bodies. And so having to convince them, that is where it's really good for us. I'm not particularly interested in singing to the choir. All the folk who think the way I think and have the information that I have, come on and get on board with me so you can start talking to the people in your community who don't. I want to talk to those girls in the community who don't know that this is so. I want to talk to those, we use this information to talk to those mothers who secretly call me to say, my daughter is 13 and she has to get an abortion. Or my daughter is 13, what do I do? And so, because my church said I can't. And so we're able to use this data that we get to talk to women like that, or talk to communities before they have to call and say, or to give people the tools that they need to defend the decisions that they make with their bodies, or to see people get truly excited when they understand what bodily autonomy means. And so being able to use that, but no matter how much passion that we have for what it is that we do at the Afiya Center, absolutely nothing can beat having this data to support what we say. Because prior to me having the data, it was just, and I'm a 100% believer in anecdotal stories, because that's what I do. I tell stories. We're blessed to get some really amazing folks at the Afiya Center who can dive off into data and pull all that data and read it and do all of that, but I'm a storyteller. And so no matter how much I can draw you in with my stories and telling of the stories and using that anecdotal data, which is very important, this data right here, that solidifies what we're saying. And we're no longer saying what we think. We're no longer having to build. And so it enabled us to build a really strong, a stronger organization. And it has so expanded the work that we do.
Mhm.
And we incorporate, I know I'm at my 10 minutes. And we incorporate.
You got a few more. You got a few more.
Okay, I'll be needing that timekeeper. And I'm not going to use the whole 10. I'm have to use the whole 10 minutes because I'm running out. And we incorporate this data into every aspect of our work because not environmental, but environmental justice is very important. But economic justice is one of the very things that we hinge the work that we do on. And there's just enough in here for us to support what we say as it relates to folk making the choice that they make. And also, I was really super excited to see us include racism and violence. We know that violence is sometimes the reason why many young women say, well, I'm not going to have any children because they're going to be killed anyway. And so now having something to support that data that says, yes, this is what young Black women are saying is very important, especially as we try and incorporate the work that we do with the resistance that's happening on the streets right now and helping people to understand that it's not police violence don't just look like the police shooting us down in the street, but let's talk about state sanctioned violence and what that really means and how we include and that and how we bring Black women more solidly into that table when we're talking about what it means to reinvest or reimagine what safety and all of these things look like. So that's pretty much what it means for us. It just really helped us to give real solid proof of the work of the things that we've been saying all along, and it support the women who are making those choices that they have to make for themselves without any apology.
Thank you, Marsha. Thank you, really, thank you. That was a really good synopsis of how we engage as the Afiya Center and how this data is important to us in the work that we do, in the comprehensive work that we do. We will now hear from Representative Toni Rose. The Honorable Representative Rose is currently serving her 4th term in the Texas House of Representatives representing District 110. The district includes the diverse communities of Oak Cliff, Highland Hills, Pleasant Grove, Balk Springs, and Mesquite. She was born and raised in Dallas. Representative Rose developed a passion for civic engagement at an early age, which mirrors her work in mental health, social justice, and criminal justice. Representative Rose obtained a Bachelor's of Science degree in criminal justice from Paul Quinn College. Representative Rose's passion continued during her tenure in the Texas legislature, where her legislative focus includes mental health reform, access to affordable health care, improving the quality of life for our aging population, and underserved communities. Representative Rose holds key leadership roles and serves on several prominent committees. She serves as chair of the Appropriations Subcommittee on Articles 6, 7, and 8. As subcommittee chair, Representative Rose leads budget conversations on issues of natural resources, business and economic development, business regulation. Representative Rose also serves as chair of the Joint Legislative Committee on Aging, which comprises of members of both the House and Senate, as well as the public. Representative Rose, how does this data speak to you in your role as a state legislator working to advance health equity and improve health outcomes for Black women and vulnerable communities, especially in your committee leadership role? What are your biggest concerns during COVID-19 heading into the new legislative session? And finally, what legislative actions at the state level do you think need to be taken, and how do we build support in a historically conservative state?
Well, thank you, Deneen. I really appreciate that introduction. I just have one complaint. I mean, why would y'all put me behind Marsha? You know, she's such a fireball, and I really appreciate and admire her passion. To be honest, I mean, she really inspires me to, you know, really want to just deep dive in and do the work, and I really appreciate that. But before I begin, I just like to say that I'm thrilled to be here with such wonderful and dynamic organizations who are dedicated to protecting Black women across our various stages of growth and validating our experiences across the spectrum of today, of the challenges we collectively face today. Specifically, I'd like to thank and acknowledge in our own voice for co-sponsoring this morning's event. Your work to support the human right of Black women to control our bodies, our work, our gender, and our reproduction has been invaluable. Special thanks to my partners, and they are my partners over at the Afiya Center, for extending the invitation for me to be with you all today. You know, from HIV to maternal mortality, to transgender violence, to reproductive justice, the Afiya Center is the premier source of effective database advocacy and on-the-ground action in Dallas County and beyond. I've been very impressed with the state of Black women's report in Texas, which provides the most current data and recommendations around critical issues impacting Black women, as well as the stories behind the real people impacted. You know, your impact is felt from the neighborhoods from southern sector of Dallas all the way to the state capitol. And so we really appreciate it. So I'm going to address your first question, which has to deal with the role of data as it relates to my work in the legislature. And so I would say that, you know, putting all politics aside, you know, accomplishing policy change in the Texas legislature requires data. I mean, that's just pure and simple. Data is required to demonstrate how many Texans are impacted by an issue, how they are impacted, the cost of the proposed solution to the state, and as the state's population both grows and changes, it also helps with future projections regarding the issue. You know, for example, one of my bill proposals this year impacts maternal mortality. The proposal would cover women who give birth or experience a miscarriage with 12 months of health coverage instead of the current 60 days that they currently have. So accurate data is necessary to determine how many women are impacted by an illness that may lead to maternal mortality, the cost of the emergency healthcare services for those women who don't have insurance of their own, and, you know, and so forth. So once the data is complete, you know, calculations must be made to determine the cost of health coverage for all the women projected to become pregnant and require state health services. These are necessary calculations that must be considered to arrive at the cost of the state to implement the maternal mortality bill. And also these calculations are made for every single bill proposal, so lawmakers can determine if the state can afford to implement the change and the cost if the state makes no changes at all. So in every case, you know, making an argument regarding a bill proposal require that we have good, accurate data to use in determining what issues are most critical to the state of Texas. And I believe, and the second question you asked me as it relates to COVID-19.
Correct.
I would say this, one of my biggest concerns, and I'm just going to be transparent and open. I mean, I'm really concerned about my own health and safety as we return to Austin for the next legislative session. But, you know, at most, you know, base level, I experience the same concerns as each and every one of you regarding personal safety, concerns about friends and family, and the general alarm regarding the rise and fall of infection numbers. When I view those concerns through a legislative lens, though, they compound and multiply, expanding beyond the individual and the family level. As a legislator, I'm concerned about the disparities in medical treatment. I'm concerned about the health conditions that are most prevalent amongst minority populations like hypertension, diabetes, and other ailments that contribute to the high death rate among minorities due to illnesses like COVID-19. I'm concerned about access to health care most of all, and the expansion of Medicaid as the most logical fix to help Texas families. We must expand Medicaid in Texas. I'm also concerned that the Texas legislature is filled with the brim, filled to the brim, I should say, with individuals who would deny health care measures that would correct maternal mortality because of politics. So while COVID-19 is a major issue, there are more underlying issues that must be addressed to bring this pandemic under control. And many of those issues are longstanding and well documented. And as it relates to legislative action, in terms of legislative action, and I know I'm running short of time here, but I think you understand the gravity of Medicaid expansion, of closing the door on maternal mortality, of improving access to health care by creating jobs with living wages. This is all played out in the halls and the drama of the Texas Capitol. We must show up during the legislative session and tell those stories during committee hearings and while visiting legislative offices to educate lawmakers about the importance of the issues that impact our communities the most. We must take that data and make it real for those who are making the decisions, and we must gain allies amongst other groups of people who may have different backgrounds, but are committed to finding the commonality of humanity and decency. And we are willing to come together and fight and defend it. So that's what I love about the Afiya Center and the work that you all are doing. You are warriors, and I love each and every one of you for it. I'm looking forward to fighting alongside you as we work to bring lasting change across Texas for Black women. So thank you.
Thank you, Representative Rose. We will now hear from Dominique Walker. Dominique is a on-the-ground organizer. Her organizing background includes work in children's advocacy. Sorry, y'all, I hit the thing and turned my light off. Criminal justice reform, immigration reform, LGBTQIA rights, and women's reproductive freedom. She works to challenge philosophy by using writing to agitate conversation and action around how our various intersections affect our lived experience. Dominique is the mother of a future revolutionary and believes we are all connected in this work. So engaging the revolution is a part of taking responsibility for what we owe to each other, our future, and to ourselves. Y'all, let's give it up for Dominique Walker. Hit it. Oh, I need to give you a question, don't I? Okay. I got so excited. So, Dominique, a significant percentage of respondents, especially younger women ages 18 to 34, said that over-policing factored into their decision-making about whether and when to have a child. Younger Black women also notably reported that racism in Texas significantly impacts mental and emotional health. Do you see these as prominent issues affecting young Black women in the state of Texas right now? Are there others? What community level actions can be taken to address these issues? And Dominique, before you begin, what I want to say to those who are listening, when we use the term women throughout this presentation, we use the X. And so we are not just talking about cisgender women, we're talking about trans identified women, and we're also talking about those that are non-binary. I wanted to make sure I included that because it came to my mind, and I wanted to say that before we begin the rest of the discussion.
Yeah, so to answer your first question, absolutely, racism would exasperate anybody. And it's an ever-present threat to all Black lives. It always has been. It seems like it is an uphill battle that we are continuing to have to fight. But as long as any entity that's judges, prosecutors, police force, anybody is supported by their prejudice and their ability to couple that with their state-given authority over us, we're always at risk. Other issues that are affecting young Black women is lack of access to quality everything. So housing, education, healthcare, water, food, jobs with sustainable wages. Our mental health infrastructure is fractured and it's overloaded. I know so many Black women who have been waitlisted through the duration of this entire pandemic, and that shouldn't be the case. And if you add family separation through family courts and through incarceration to that list, it's like the vulnerabilities and the attacks on our lives just don't stop. So yes, the data supports, like to Marsha's earlier point, what we already know. How do we address this kind of stuff? I think we'll have to build our community level resources outside of state institutions, outside of things that are controlled by the state. We have to continue to take care of us if/when our governing bodies won't. I don't think our lives were ever considerations in the process of these institutions being built in the first place. So why would we expect these things to save us? Our sense of security can't rely on just police. That doesn't make sense if that is an area that we're experiencing harm. So our security has to be divested. Relying on government handouts for access to like quality, fresh produce doesn't make sense. Again, through this whole pandemic, that's why you saw people like starting community gardens. You saw community level like organizations doing food distributions, because we can't continue to rely on those who are supposed to protect us. But until then, until we reach this promised land of divestment, of reinvestment in ourselves and like our own abilities, we have to continue, or somebody has to continue to push our lawmakers. Somebody has to make sure our voices are heard. Somebody has to make sure that we are not ignored, our needs are not ignored, our lives are not put on the back burner, which means that somebody has to pay attention to what goes on in our cities and in our state legislatures. Somebody has to have those relationships built and firmed up so that when we do need things, we have resources to go to. And so that includes plugging into politics, which is events like this, organizations like the Afiya Center, who has our best interests at heart, and our own voice that has our best interests at heart. That's where our effort will have to be placed.
So thank you, Dominique. We have one last question that I would like Representative Rose and Marsha to take a stab at, starting with Marsha. It says, Marsha, from lack of congressional response to COVID-19 to threats to the ACA at the Supreme Court, we know that what's at stake in the federal landscape impacts Black women's access at the state level. What new approaches is the Afiya Center taking to meet community needs in the context of this health pandemic, excuse me?
So, yeah, I got up to run. I was gonna run upstairs right quick. So I probably need to breathe.
So Representative Rose, you can go first.
So one of the things that I think is super important that we have to look at is almost kind of like almost what you were saying, kind of Dominique. We gotta take power. We gotta take our control. We really don't have to take it back because it was never there for us anyway, right? And so what we've got to do is what I want to see the Afiya Center doing is building power in the community, building community power. Building a way in which we can start to move to be a little bit more self-sustained. Really informing, bringing all this stuff to light to the community. I'm not walking away from voting and all of that kind of stuff, but seeing more folk running for office that look like the folk that they're representing, and I'm not just talking Black folk now. I'm talking about folk, just folk running for office. And I'm looking to build that kind of power, building people power. If we don't build people power, we're going to be where we are. I think this is my sixth legislative session where we're begging the Texas legislators to give us a basic human right, and that's access to health care. I think this is my fifth or my sixth. I don't know. It's been so many because I think about 2 legislative sessions ago, I said, you know what? I can't keep running up there begging them to give us health care. They're not going to do it. And so we've got to find a way. We've got to find a workaround for having to rely on the systems that oppress us to help us. And I think the best way to do that is to build community power.
Representative Rose, would you like to add something?
Well, bro, you didn't run up them stairs, did you?
So this is for either of you. What can those of us
I'm
who
sorry, my staff had to come and assist me. I'm sorry. Give me a
I just didn't want you running up them stairs.
Listen, I did run up some this morning now. So I know how you feel right now. Deneen, could you please repeat the question? Or give
okay,
me a new question. I think, Marsha,
okay, so what can those of us who live outside of Texas do to support Black women within Texas? How can we use our platforms effectively to support?
Well, I think one of the things that that has already been done is this report. I mean, this information is phenomenal, and I think it's going to be. I know it's not that I think it's very valuable, because once you have the data, you can make the case for it, and so I think the work has already, the report itself is great. Of course, around the country, when you have, this issue again is something that's all around the country, but I'm going to say this, and I really want us to be prepared next legislative session, because of the dynamics and the changes, I really do believe I'm already hearing rumors about, bills to ban abortion. So what I would say is right now, let's start strategizing. If they do, we'll be ready. And if they don't, we'll still be ready. But I think it's something that we really need to do to be prepared for next legislative session. But I think providing this type of information on these types of reports really help us.
Representative Rose, first, thank you for speaking today and for your courageous service. This is from Ms. Bishop. How can advocates hold their elected officials accountable for pushing forward a policy agenda that centers on reproductive justice?
Okay, say that again.
How can advocates hold their elected officials accountable for pushing forward a policy agenda that centers on reproductive justice?
I think one of the things that they can do is have conversations. I tell people all the time, we may not have the same position on the issue, but I'm always willing to listen and be open to those conversations. And you never know how you may be able to change a person's mind. We have to do that even as legislators. I have Republican colleagues, and sometimes when I go and speak to them about a particular issue that I want them to pass, some of them would tell me, well, Toni, if you give me the talking points or something, the information to address my constituents with it, I would be more than happy to support you. And that's one of the reasons I've been able to work on both sides of the aisle. Sometimes, we think Texas is a one-size-all-fit, it's not a one-size-all-fit state. Every area is different. So the issues that impact my community do not impact some of the legislators on the floor. So sometimes I have to go and make the case and have them to understand what is going on in my district. So it's all about communication.
Thank you. Do we have any more questions from participants? Those were really good.
And thank you, Ms. Bishop, for the question.
Yeah, it was a good question. Okay, so they coming. Miss Ebony Johnson asked, what are the ways that folks in the community can engage? I will pass that one to Dominique.
What are the ways that folks in the community can engage? Mm-hmm. So I think signing up with organizations, I answered the first question that way, Ms. Common's question that way, but I think we need to start building a resource pool of people who support Black women in Texas, people who support Black women and Black women's issues specifically. So signing up to stay in touch with organizations like the Afiya Center, organizations like In Our Own Voice, meeting with the leaders in our community, like Ms. Marsha, like Reverend Deneen Robinson, like myself, like any of the leaders that you see doing movement work in the community, there's a huge body of work that is ongoing all the time. So any way that you can engage and connect with people who are already doing the work to amplify that work, or to help the parts that are, you know, the gaps that are not being done right now, that's all helpful. But I would always suggest starting with the people who are standing in the pain and that are, you know, the ones who are managing it the best, who are the people who are closest to it.
Dominique, one more question. Young people showed up and showed out in record numbers this election cycle. This is for you and Representative Rose. What can we do to ensure that we are making room for the young people at the decision-making table, particularly around RJ issues? And Marsha can chime in on this answer too, as a person who actually has a table.
I think for myself, I think the young people who have been showing up and who are engaging in this work are very vocal, very bold. So I think it's up to everybody else to kind of listen to the elders, listen to the people who are coming up behind the work and are trying to, you know, grab that torch and carry it through. But I think we're already doing the work. I'm speaking myself as a young person as if I'm like really young. I'm 29, but I still consider myself a young person. But yeah, I think we're doing the work. It's just a matter of like collaborating, people being more willing to fold us in to the various ways that the work is being handled.
Okay. Okay.
Yeah, I would just add that I just think you just have to be open. You know, sometimes people can get to the, I'm a Generation X, let me put it that way. And I have the mindset of being open to listening to, you know, millennials or young people. One of the things I've been able to build, even in my office, my chief of staff is millennial. Are you an X? Oh, I'm sorry. She is a millennial. And so, you know, I mean, and, you know, but you have to listen to them. A lot of times, and what I can say about millennials, I mean, this is a generation that is very engaged. You know, I just so happen to be engaged in politics because my dad was a politician, but a lot of my friends were not as engaged politically as I was. But I'm just glad that now that we have social media, I know it can be a digital demon now, but I do appreciate social media because it's able to give, you know, it's a platform for people to get information. I mean, the good information, the factual information, I should say. And so I think what it has done is caused millennials to be very engaged in the political process. And so, but we as older people have to be open and willing to give them opportunities. And so, and when I was referencing my chief of staff, that's what I was referring to. I gave her an opportunity. She's a very smart young lady, lawyer, an attorney. And so, and only 27 years old. So you have to be open and willing to, you know, give them opportunities.
So thank you. We have two more questions. Okay, yeah, one person asked two questions. So I'm going to work to combine them. Representative Rose, you spoke to this. Are there ways we can combat the constant flooding of misinformation on social media and other platforms that impact how people are making decisions and voting in Texas and beyond? Any of y'all can take that.
Okay. What about social media? Oh. I don't know why I'm having a trouble hearing. Let me turn mine up a little bit. Okay, I'm sorry.
That's okay. So what are the ways, what can we do to help people respond to and deal with the overwhelming and often flooding misinformation that they receive on social media?
Oh. If I had the answer to that question, honey.
I can answer that one.
Everybody's doing the same thing. All three of you are doing the same thing.
You can't make people stop putting out misinformation. Right. What you can do is put the right information out and do your best to educate the people who are closest around you, because that's the stuff that's transformational. The social media going back and forth, that doesn't really change as much as people think. It might change you internally and how you feel, but like that's not the stuff that's moving lawmakers to the point that people think.
I'm sorry. You also have to consider the source of the information. Make sure it's coming from a organization or a publisher who's reputable. You know, sometimes you can, you know, even in my emails, or I get information and it'll sell me things about my Chase account. But when you look at the address, it's some crazy email address. So you have to check information and you have to verify it.
That's really good. So this last question I'm gonna put to Marsha. How can we mobilize HBCUs in the district, such as my alma mater, Paul Quinn, around RJ, abortion access, and maternal health? Also, how can we build new relationships with legislators who support Black women's reproductive justice and rights out loud? So that's two questions. The second one I would lend to Representative Rose, and the first part of the question to Marsha, and these were both asked by Starbrit.
So I think it's really cool. We're in a really cool place now. I know. I also went to Paul Quinn, Representative Rose. Yeah, I went to Paul Quinn for a minute, but I mean, I did some. Anyway, let me get back. But we're in a really cool place now with this. I'm not gonna call it an obsession because that makes it sound so bad, with the Divine Nine, and everybody's pledged, and it's a really cool thing now. When I went to school and I was already a mom and I was trying to get out of school, I've been trying to play as Jack. I was trying to take care of, I was trying to buy chicken for my folk to eat. But now people are doing it. So I think the thing is tapping into that. Tapping into that thing. It is really amazing on these campuses. I'm gonna tell you, I loved it. They wasn't quite as active, but walking through their campus and they're and so seeing that stuff on those trees and stuff, that was such a sense of family camaraderie. So tapping into that, tapping into something that's working. Finding folks, so you got to find where you have your most power. Whenever people ask me, how do you be a power? I say, you go to the place where you have the most power. If it's the bus stop, that's where you go. Wherever people will listen to you. So connecting with these people who are already in these campuses, we don't need to try to go to the campus ourselves. We need to connect with the people who are already on the campus, doing this work in a way in which it's already being done. Especially now, this is amazing since our vice president-elect is a part of the Divine Nine. So now everybody want to be a part of that. Everybody want to be connected to the best thing. So this is the new orange is the new black. And so connecting to that, finding the thing that folk are now committed to. Yeah, you're gonna have some kind of folk who want to do it just because. You're not worried about that. There are gonna be always some people that it's gonna stick to. So you have to find something that's already being done. And then the last thing is you gotta make the connection. You have to make the connection. Part of the reason that we've been successful with our abortion work is because we guided the conversation. We didn't let the naysayers out there guide us. And we made the connection. We made the connection with community, with family. We made the connection with economics. We made the connection with gender. We made the connection with our blackness. We made the connection. And so that's what you do. You make the connection. Paul, we need folk like that on the campus. They might not know it yet, but they need us out there. The conversation we have so impact every student on the campus.
Representative Rose.
First, I would like to thank Star for the question. And Marsha's right, you have to make a connection. And I think that was one of the reasons that they kept acknowledging the Divine Nine, because we know Black women vote. And so I think we're really trying to make the connection because they know that Black women, we have been the backbone of the Democratic Party, and we are the ones who are electing people. And so I know that's why they make that connection. But as it relates to Paul Quinn College, I'm very proud to say that Paul Quinn College, every legislative session has a Paul Quinn College Day, and they come down to the Capitol. It's a very good experience. You know, Paul Quinn College was founded in Austin. A lot of people don't know that. It was founded in Austin at a small church that's actually close to the Capitol. And then it moved to Waco, Texas, and was in Waco for many years. And then the college moved to Dallas in 1990. And so on Paul Quinn College Day, you know, the students are able to visit all three campuses in one day. And they come down and they, even last legislative session, one of the hot topics was this bad voter ID bill. And they came down and spoke against the bill and participated in the process. So Paul Quinn is very engaged with the legislature. And so, and you know, Dr. Sorrell there, he's very supportive of that. And so Paul Quinn College is, they're in the trenches of it. So.
But you know what though? That's really great. I just thought about something while you were talking. But you know what we're letting slip between our fingers? We're letting these community colleges slip between our fingers.
Yes.
Yeah.
You know, we put a lot of focus on, and rightly so, HBCUs, but these community colleges are flooded with the kids who come directly out of our communities.
That's true.
Directly
Right.
out of our communities, who are so impacted by the things that those systems that we're fighting to deconstruct and change. And I think that some of the, so this is to the question, the person who asked the question, we are really focused on these HBCUs, but how do we share that focus, or how do we redirect that focus into community colleges? Because that, I think, sometimes where we have the least amount of access, and where we have the biggest population of folk that we really need to meet. We're gonna meet our most young women who either have been parents more than once before they even got out of high school. We're gonna meet a lot of kids there who have families that are directly impacted to immigration issues, criminal justice issues. All of these things are so fresh, and I think that that's a place that we are not having enough of a conversation at, and that's community colleges. But that's it.
So first of all, I want to say thank you, Marsha, Dominique, and Representative Rose, along with Marcela and the In Our Own Voice team, for this wonderful polling data discussion, but more importantly, the dialogue that we've been having. And in answer to the last part of Star's question, I really think that we have to continue to introduce RJ to our to our legislators in general, initially targeting our Black legislators, both Democratic and Republican, and give them the language and the opportunities that they need to engage this out loud. I want to say to you all that that have joined us via Facebook, as well as those who have provided questions for us and participated with us on Zoom. Thank you so much for your attention and your time this now afternoon. And I'm going to give you back the rest of your day and ask that as a way of leaving and continuing this discussion, is that you commit to sharing at least 5 things, sharing with 5 people that you love, something that was impactful to you from what you have heard and experienced today. This is how we keep this going. This is how we engage in the transformation that Dominique talked about. This is how we meet those people who are impacted by the work that we do and what's happening in the state of Texas and our world today. And we'll be seeing you, Representative Rose, in a few weeks, because it'll be January before we know it.
Right.
So,
Looking forward to it.
so thank you all again. Bye-bye.